The doffing process is conducted under the supervision of a trained observer who will read each step of the procedure aloud and confirm visually that PPE has been removed properly. An assistant will help as needed with removal of the PPE.
I will be reading to you the step-by-step instructions as we go along.
The operator will stand in the doffing zone to remove the PPE and await instructions for removal. The PPE removal process takes approximately 15 minutes. Avoid reflexive actions that may put you at risk, like touching your face. The front of the suit is the most contaminated. Keep your hands out and away from you at all times during the doffing process. For doffing of the contaminated PPE, it is important the assistant is dressed in full PPE and that the trained observer stands outside the doffing zone with face shield, surgical mask, gown, and 1 pair of gloves.
Perform a final inspection of the healthcare worker for any indication of contamination. If there is a breach in the PPE, document on this record.
The assistant should conduct a final visual inspection of the healthcare worker for any indication of contamination. If there is a breach anywhere in the PPE, document on the doffing PPE checklist. The operator should slowly move in a circle in the same spot so the assistant can fully assess the PPE without having to walk around the observer. If the PPE is visibly soiled, the operator or assistant cleans the area with Oxyvir wipes and allows it to dry for 1 minute. The operator and assistant will disinfect outer gloves with Oxyvir wipes and allow to dry for 1 minute. The operator will carefully remove outer exam gloves only. With the first glove, hook 2 fingers on the outside of the glove and pull the glove off. Discard the glove into the red biohazard waste bin. With the other hand, carefully insert the clean gloved finger between the inner and outer gloves and remove the outer glove. Discard the second glove into the red biohazard waste bin. The operator will disinfect the second layer of gloves with Oxyvir wipes and allow them to dry for 1 minute. The assistant unties the plastic apron at the back and breaks the perforated seal at the neck of the apron. Next, the assistant pushes the apron forward off the operator's shoulders without touching the operator. The operator then folds the apron down from the chest and carefully rolls the apron off by rolling it in on itself. The operator must avoid movements that could spray body fluids around the room or on the assistant. Once removed, the operator will discard the plastic gown in the red biohazard waste bin. Both the assistant and operator will disinfect their gloves with Oxyvir wipes and allow them to dry for 1 minute. The operator then sits down on the stool to roll shoe covers down and remove. If necessary, the assistant can help take them off. Do not cross legs. Note, the stool will be cleaned later before the suit is removed. The operator must now disinfect their gloves with Oxyvir wipes and allow them to dry for 1 minute. The assistant will also disinfect their gloves with Oxyvir wipes if they helped with the removal of shoe covers. The trained observer and assistant will inspect the PPE to assess for visible contamination, cuts, or tears before starting to remove the jumpsuit. If any part of the PPE is visibly contaminated, the operator or assistant will clean the area with Oxyvir wipes and allow to dry for 1 minute. The operator will carefully open the storm flap of the jumpsuit by sliding a hand under the flap to release the adhesive edge and expose the zipper of the jumpsuit. They then tilt their head back to allow the assistant to unzip the jumpsuit to the chest. The assistant checks with operator that they are ready to be disconnected.
Lauren, are you ready for me to turn off your papper?
Okay?
The assistant then turns the papper off and immediately disconnects the hose from the hood. The observer hands the assistant the cap for the hose, and the assistant places cap on the end of the hose. The operator must then reach one hand under the storm flap at the chin and the other hand at the top of their head. While leaning forward, close your eyes and slowly remove the hood by pulling away from your face. Again, it is important to take precautions to not spray any contaminants on the assistant. Once fully removed, immediately discard the hood in the red biohazard waste bin. The assistant will hold the PPE unit while the operator unbuckles the belt. The assistant will place the PPE unit and attached cap hose in the biohazard bin for cleaning and disinfection. The assistant and operator will inspect the operator's gloves' outer surfaces for visible contamination, cuts, or tears. Both operator and assistant then disinfect gloves with Oxivir wipes and allow to dry for 1 minute. In order to remove the second layer of gloves, the assistant must first remove the duct tape on the operator's wrists by pulling the pull tab and discard the tape in the red biohazard waste bin. The operator then hooks 2 fingers on the outside of one glove and pulls the glove off. Discard the glove in the red biohazard waste bin. With the other hand, carefully insert the clean gloved finger between the inner and outer gloves and remove the outer glove before discarding into the red biohazard waste bin. The operator will disinfect the chair and chair legs with Oxivir wipes and allow to dry for 1 minute. The operator and assistant will disinfect gloves with Oxivir wipes and allow them to dry for 1 minute. The assistant will check the operator's jumpsuit for visibly soiled areas and clean with Oxivir wipes as needed.
All clear.
After inspection, the operator can unzip the jumpsuit completely. The assistant then stands behind the operator and assists by sliding the jumpsuit down from the shoulders and easing down the sleeves of jumpsuit over the gloves. Carefully roll the suit outwards away from the body onto itself, exposing the clean inner side until the arms are out of the sleeves. Be careful not to touch the operator's scrubs. Continue to roll the jumpsuit downward toward the operator's feet. When the suit is close to the ankles, the operator sits on a clean chair to continue removal of the suit without touching the outside of the suit or the shoes. The operator can then safely step out of the jumpsuit and discard the jumpsuit in a red biohazard waste bin. The operator will then disinfect the chair and chair legs with Oxivir wipes and allow to dry for 1 minute. The operator and assistant will disinfect gloves with Oxivir wipes and allow them to dry for 1 minute. The operator will sit on the chair facing the temporary wall entrance in 11 South. Use Oxivir to wipe down every external surface of the washable shoes. Use at least 1 wipe per shoe. Start with the foot closest to the clean area and place the foot on the clean side of the chair when done. Disinfect the other shoe and swing the foot over to the clean side of the chair. Give Oxivir wipes to the assistant to discard in the red biohazard waste bin. Stand when finished. The operator and assistant will disinfect gloves with Oxivir wipes and allow them to dry for 1 minute. The operator will now remove their gloves. With the first glove, hook 2 fingers on the outside of the glove and pull the glove off. Discard the glove into the red biohazard waste bin. With the other hand, carefully insert your clean finger between your skin and glove and remove the glove and discard into the red biohazard waste bin. The trained observer pumps Purell into the cupped hands of the operator for hand hygiene. The operator performs standard hand hygiene, covering all surfaces of hands and wrists thoroughly. The operator should then remove the hairnet, if worn, and discard in a red biohazard waste bin. Perform hand hygiene with Purell again. The trained observer is then to perform a final inspection of the healthcare worker for any indication of contamination of the surgical scrubs or disposable garments. If contamination is identified, the trained observer will immediately inform the site manager, and the operator will await further direction before exiting the area.
All clear. You can go take your shower now.
The operator will leave the PPE removal area wearing dedicated washable footwear and surgical scrubs or disposable garments. Showers are also strongly recommended at the end of each shift for staff performing high-risk patient care or participating in PPE doffing procedures.